So let's take a look back at lifestyle interventions and some of the research that's available. One of the most compelling pieces of research is that I think you guys might agree with when you're looking at your diabetic patients. So this was published in the New England Journal of Medicine. So New England Journal of Medicine is probably considered one of the most prestigious medical journals in the world, well respected amongst the medical community. They did a long-term trial looking at the reduction in the incidence of type 2 diabetics with lifestyle intervention or the drug metformin. So you guys heard of the drug metformin before? Yeah. Metformin is probably the most common drug written for patients with blood sugar issues. It's a good drug. It tends to do its job. So this was deemed the DPP trial, Diabetes Prevention Program. So they looked at pre-diabetic patients. They split them into 3 groups. So patients who are generally on their way to frank disease diagnosis, frank diabetes. And they split them into 3 groups. One group, a placebo. What they did with this group was basically just kind of let them flow along the normal lifestyle that pop culture would take them. Didn't really give them any advice, just kind of people who were just taking their own health in their own hands and following recommendations of pop culture. One group took metformin. One group was prescribed lifestyle change. It was a 7% reduction in body weight and 150 minutes of light activity per week was their prescription, which is the equivalent of 30 minutes of walking 5 days a week. So they were prescribed to walk 30 minutes 5 days a week and lose about 7% of your body weight. So after 4 years, they examined the populations for who developed diabetes. Out of these 3 groups, who were the most that developed diabetes? Well, as predicted, the placebo group developed the most cases of diabetes. So these patients have advanced from being a pre-diabetic into a diabetic. The metformin group was 31% less. So they took metformin, they were able to manage their blood sugar, they were able to manage their progression into frank disease diagnosis. However, the lifestyle group, which was 150 minutes of walking per week, 7% reduction in body weight, lots of those patients actually were not compliant on the body weight, unfortunately. But the 150 minutes of walking per week had almost double the reduction of the progression into diabetes over the most popular drug, which is metformin. So this just shows you that when looking at preventing diabetes or kind of reversing your trend or your trajectory into diabetes, that nothing is more powerful than lifestyle, not even the most commonly prescribed drug for the condition. So lifestyle medicine is powerful. We all have a genetic predisposition, although your genes are not going to determine. You're not doomed by what your genes tell you. Whether it's diabetes, my dad had diabetes, you're not deemed to have adult onset diabetes because my father had diabetes. It's basically a combination of your lifestyle that you lead with your genes. So you'll see the first picture here is a gentleman eating a nice roast beef sandwich. That in combination with the genes that might be more predisposed to these conditions gives you more risk. It gives you more disposition, or you're more disposed to disease. The lady on the bottom, she's eating a huge chunk of broccoli with her genes, which gives her less risk, less disease. So even though, let's say both of these genes here, his genes, her genes, both have diabetes, cancer in their family, she's reducing her risk through a lifestyle modification approach. And in this situation is diet.